Hi, my name's Mariam, and this summer I got the opportunity to work on an amazing project titled A Perfect Storm: The Effects of Mandatory Homeschooling on Parents' Mental Health and Substance Use During Pandemic Lockdown. Coronavirus disease 19, or COVID 19, first arrived in Canada in January 27, 2020, when the country's first confirmed case was reported. On March 11, 2020, the World Health Organization declared the COVID 19 outbreak a pandemic, and by mid to late March, as part of a countrywide effort to slow the spread of COVID 19, schools and workplaces were closed. Unfortunately, this left many families sheltering in place, with parents now taking on the additional responsibility of homeschooling their children, while many also had to adjust to working from home. So this summer, my co-supervisors, a clinical psychologist and a developmental psychologist, developed a team to examine how this mandatory homeschooling impacted parents' mental health and substance use during pandemic lockdown. Accordingly, in June 2020, 760 Canadian couples were recruited and surveyed using Qualtrics panel surveys on their experiences during lockdown. Participants retrospectively reported on the month of April 2020, close to when schools were first closed. Further, we used the analytic technique known as actor-partner interdependence models, APIMS for short, in order to measure the influence that members of a couple have on each other. In APIMS, and controlling for respondent age, we found that the 203 couples homeschooling children reported less optimism, more role strain, and more cannabis use to cope with both depression and anxiety as compared to couples not homeschooling children. Among couples with children, more hours spent homeschooling was associated with greater anxiety, depression, and COVID-related traumatic stress in the individual, as well as greater drinking frequency, quantity, and binge drinking in their partner. There were also several interesting gender differences. For example, we found only mothers' hours spent homeschooling, but not fathers' hours homeschooling, to be positively associated with the drinking frequency of both mothers and fathers. In conclusion, these findings are of grave concern, given that increased psychological distress and substance use among homeschooling parents is likely to impede their ability to cope and support their families in these challenging times. Accordingly, future research should attempt to investigate how these negative consequences on parents impact their children's mental health. I would also like to thank Dr. Sherri Stewart and Dr. Elgendi, as well as all the members of the Language and Literacy and MAC Labs for supporting me this summer and allowing me the opportunity to be a part of this amazing project. Thank you.